Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And with me in the studio today is Professor Bertram Wiedenmann. He's a liver specialist at the Charité University Hospital here in Berlin. Dr. Wiedenmann, hello and welcome to the show. The patient we just saw in the report wasn't overweight or obese, but still was suffering from the fatty liver disease. So why is that?
I think three issues probably we have to consider. One major reason is definitely alcohol, no doubt about that. And then I think secondly, we definitely have also a number of metabolic diseases that we have to consider regardless if the patient is obese or not. And that's mainly diabetes. And secondly, also some diseases that relate to the lipid metabolism. And thereby patients may develop liver disease to the extent that they finally, over years, even move into cirrhosis of the liver.
Okay, so it's a lot about nutrition, like alcohol, sugar, and fat. So it's more or less lifestyle. So if I change my lifestyle, could I then just cure fatty liver disease?
As long as you do it in early stages, definitely yes. The problem is we, as you mentioned before, do not feel our liver to the extent that we know that we're going through a long phase of fatty liver disease and eventually end up in a stage where the liver already becomes fibrotic and maybe even end up being cirrhotic.
And when it comes to alcohol, how much is okay? Can I drink any alcohol at all, or is it every tiny amount dangerous to my liver?
Well, I think we can be puristic and say probably alcohol is not good by all means. But on the other hand, I think if you look at the WHO criteria, we have to differentiate between women and men. Men are allowed to drink more alcohol, and we talk about 20 to 30 grams per day. And in women, it's 10 grams less, so 10 to 20 grams per day, meaning that you probably can drink a glass of alcohol. And that means if you consider that for a period of a week, you can drink 5 days a glass of wine, and you should stop also for 2 days during the week.
So it's not even one glass of wine per day. One glass of wine per day would be too much.
Over a week, yes.
And if I would drink a lot of alcohol over the weekend, is it okay to restrain from alcohol over the next week? So can the liver regenerate?
I think you have to give your liver at least a rest then for a longer period in order to regenerate.
Are there any early warning signs for fatty liver disease that a patient can recognize to say, okay, now I have to go to see my doctor?
No, I think the problem is the moment the disease starts, we do not feel it. And the only way to check it is in the first place to have some blood drawn. And in the second place, also, you need some kind of image of the organ, and that is by ultrasound. That's the cheapest way. And if you have some kind of idea as a doctor that the liver is fatty and also the blood values are raised, then you may go for a more defined diagnostic, even up to a biopsy.
We got a viewer question from China. Jens Lipp tells us that he's got fatty liver disease, and he's very concerned about the long-term consequences. So what are long-term consequences of fatty liver disease?
Well, I think if you have it over a long period, that means you talk about decades and even longer, you get some kind of scarring changes of the liver in the long-term chronic inflammation. And with that, you may even end up with cirrhosis of the liver. And even further, you may go into a stage where the liver becomes cancerous. And there, of course, you are in the end stage of a long ongoing inflammatory disease.
Until now, hepatitis C was treated with a cocktail of some antiviral drugs and immune modulators. So what's so special about this new sofosbuvir?
The new drug is really a breakthrough, as we just heard in the contribution. First of all, I think we have a drug that has by far less side effects than previous therapies. And on top of it, it's a therapy that only is given for 3 months rather than 12 months in the past. And with that, we really have a breakthrough that will be even potentiated and be stronger once we have in fall another drug that is given together with the sofosbuvir. And with these two agents, we can more or less eliminate more than in 90% of the cases the virus in all patients.
So hepatitis C gets curable, and it's a very short period of time with low side effects. But is this kind of treatment appropriate for all kind of hepatitis C patients?
As far as the data we have so far, of course, the drug hasn't been used in a large number of patients. But with the studies so far at hand, it looks as if we probably will be able to eliminate almost all the patients with a viral disease in their liver. So that's really a breakthrough, and we have 2 golden bullets, if you wish so, to cure the patients, hopefully in earlier stages and not as only in late stages.
And hepatitis C has been a huge challenge for medical science, but most common and dangerous form of viral hepatitis is hepatitis B. And we got a viewer question. Hermes Leon from Venezuela asked how people get infected with hepatitis B.
Well, I think, first of all, I think you have the issue that close physical contact is one of the major causes of transmission. Then we have the blood route, that is especially an issue for drug users, drug abusers. And finally, we have causes that we do not know, and they all together cause for the other causes for the disease.
So how can you protect yourself from catching hepatitis B? So, I mean, with intercourse, it's usually using a condom. And the other things you can do yourself to not get hepatitis B?
Well, I think the most important issue is that we have a means to immunize patients. And with the immunization, but that is, of course, given now in most countries to young adolescents, we have a chance to prevent the disease. And of course, that's the best measure. Also, with regards to cost effectiveness, one of the best measures we have at hand. Once the disease has developed and we are in a chronic stage, in usually 50% of the infected individuals, we have to treat the patients, in this case, still with interferon, as I just mentioned, in patients with hepatitis C. We do not have to use interferon anymore, but here we use interferon, and together with some agents that are called nucleoside analogs that interfere with viral replication. And by interfering with the virus replicating and being more and more in the blood, we have means also to block the disease by just eliminating the virus.
So you can treat it, but is this curable? So Coco from Myanmar...
You can. Definitely
you can cure it.
Yes. Not in all cases, and not in such high percentage as in hepatitis C nowadays, but I think you can cure it in about 50 to 60%.
But those are major breakthroughs in medicine. Thank you so much for being with us in the studio. Thank you.